Most people find out they have dangerously high blood sugar the same way. A doctor runs a routine blood test and reads them a number they were not expecting. By that point, the damage has been building for years. A study published in the journal Diabetes Care found that the average person with type 2 diabetes had elevated blood sugar for 7 years before receiving a diagnosis. 7 years of silent damage to the blood vessels, the nerves, the kidneys, and the eyes. After 50, your body loses much of its ability to signal that something is wrong, which is exactly why these 7 signs get missed for so long. Before we reach sign number 4, there is one symptom on this list that most people over 50 experience every single day and never connect to their blood sugar. It is so common in this age group that it is almost universally written off as a normal part of getting older. You will know exactly what it is before this video ends. Sign number 1. You are thirsty all the time, no matter how much you drink. This is called polydipsia, and it is one of the most consistent early signs of chronically elevated blood sugar. The mechanism is straightforward. When blood sugar rises above the level your kidneys can reabsorb, glucose spills into the urine. It pulls water with it through a process called osmotic diuresis. Your body loses more fluid than normal with every trip to the bathroom. The brain responds by triggering intense thirst to compensate for that fluid loss. A large population study published in BMJ Open found that excessive thirst was reported in 68% of people later diagnosed with type 2 diabetes, often for months or years before diagnosis. The specific quality that distinguishes this thirst from ordinary dehydration is that it does not resolve after drinking. You drink a full glass of water and feel the need to drink again within minutes. Normal thirst resolves, blood sugar-driven thirst cycles. After 50, many people reduce their fluid intake intentionally because they are trying to avoid frequent bathroom trips at night. That suppresses the thirst signal further and masks the symptom even more. Therefore, if you are consistently thirsty throughout the day, regardless of how much you drink, that pattern is not about hydration, it is about blood sugar. Sign number 2. You need to urinate far more often than you used to, especially at night. Frequent urination, particularly waking 2 or more times per night, is one of the most reliable early indicators of elevated blood sugar in adults over 50. The same osmotic process that drives excessive thirst drives this symptom. As the kidneys work to filter excess glucose out of the blood, they produce significantly more urine than normal. The American Diabetes Association reports that waking more than twice per night to urinate, a condition called nocturia, is strongly associated with poor blood sugar control in older adults. A study published in Diabetes Research and Clinical Practice followed over 4,000 adults and found that those waking 3 or more times nightly had blood sugar levels significantly higher than those sleeping through the night. Most people in this age group attribute nighttime urination to an aging bladder or prostate issues. Sometimes that is the cause. But if the frequency has increased recently without another clear explanation, blood sugar is the first thing to rule out, not the last. Therefore, tell your doctor specifically how many times you wake to urinate each night. That number is clinical data, not a complaint. Sign number 3. Wounds and cuts that take far longer than they used to heal. A cut that would have closed in 3 or 4 days now takes 2 weeks. A bruise that lingers, a small wound on your foot or leg that just does not seem to close. This is one of the most physically visible signs of high blood sugar and one of the most dangerous to ignore. Elevated blood sugar impairs wound healing through several mechanisms simultaneously. First, it damages the small blood vessels that carry oxygen and nutrients to healing tissue, reducing the raw materials the body needs to repair itself. Second, it impairs the function of white blood cells, specifically neutrophils, which are the immune system's first responders to tissue injury. A study published in the journal Wound Repair and Regeneration found that elevated blood glucose reduced neutrophil function by up to 40%, dramatically slowing the early inflammatory phase of healing. Third, it creates an environment in damaged tissue that bacteria thrive in, increasing the risk of infection at the wound site. In adults over 50, this matters most in the feet and lower legs, where circulation is already reduced with age. A wound that becomes infected in a diabetic foot can progress to serious tissue damage in days. Therefore, if you have a wound that is not healing on the timeline it used to, that change in your body's behavior is a medical signal that needs to be investigated, not treated with more bandages. Sign number 4. You feel exhausted after eating, particularly after meals containing bread, rice, pasta, or sugar. This is the symptom that most people over 50 experience every single day without connecting it to blood sugar. The after-lunch crash. The overwhelming need to sit down or close your eyes after a meal. The feeling that eating has cost you energy rather than given you any. The mechanism is a condition called reactive hypoglycemia combined with insulin resistance. When you eat refined carbohydrates, your blood sugar rises rapidly. In a person with insulin resistance, the pancreas overcompensates by releasing a large surge of insulin to manage that spike. The insulin drives blood sugar down quickly, often past the stable range, leaving you with temporarily low blood sugar immediately after a high blood sugar episode. That rapid swing is what produces the crash. It is not tiredness. It is your blood sugar behaving like a roller coaster rather than a flat line. A study published in Nature Metabolism found that post-meal fatigue was significantly more common in people with impaired glucose regulation compared to those with normal blood sugar, and that the severity of the fatigue correlated directly with the size of the post-meal glucose spike. Therefore, if you have accepted post-meal exhaustion as a normal feature of aging, it is not. It is one of the clearest real-time signals your blood sugar sends. Sign number 5. Your vision blurs at certain times of day, then clears up on its own. Fluctuating vision that comes and goes without a clear reason is a symptom most people blame on their prescription, being out of date, or on-screen fatigue. In adults over 50 with elevated blood sugar, it is often neither. High blood sugar causes the lens of the eye to absorb excess fluid and swell. The swelling changes the shape of the lens, which changes how it focuses light onto the retina, which changes what you see. As blood sugar rises after a meal, vision can blur. As it returns toward normal a few hours later, the lens returns to its usual shape and clarity. Improves. The vision change tracks the blood sugar change. The American Academy of Ophthalmology notes that fluctuating vision that correlates with meal timing is a documented early sign of uncontrolled blood sugar. It is distinct from the fixed vision loss associated with diabetic retinopathy, which develops later and does not fluctuate. If your vision is clearer in the morning before eating and blurrier in the afternoon, that timing pattern is the signal worth reporting to your doctor. Sign number 6. You have tingling, numbness, or a burning sensation in your hands or feet. This symptom indicates that elevated blood sugar has already begun affecting the peripheral nervous system. The SETI condition is called peripheral neuropathy, and it develops when chronically high glucose damages the small blood vessels that supply the nerves in the hands and feet with oxygen. Without adequate blood flow, nerve cells begin to malfunction and eventually die. The sensation typically begins in the toes and the soles of the feet before moving upward. It often feels like pins and needles, a burning warmth, or a complete loss of sensation in specific areas. A report from the National Institute of Diabetes and Digestive and Kidney Diseases estimates that over 50% of people with diabetes develop some form of peripheral neuropathy, and that in many cases the neuropathy is the first symptom that leads to a diagnosis. The critical point for adults over 50 is that neuropathy that has developed is partially reversible in early stages, with aggressive blood sugar control, but it becomes permanent if left unaddressed. Therefore, tingling in your feet that has been present for months is not something to wait on. It is a sign that nerve damage may already be underway. Sign number 7. You have recurring infections, particularly skin infections, urinary tract infections, or yeast infections. High blood sugar creates an environment throughout the body that bacteria and fungi grow in more easily. Glucose in the urine feeds bacteria in the urinary tract. Glucose in skin moisture feeds fungal growth. Impaired immune cell function means the body cannot clear those infections as efficiently as it once could. A study published in the journal Infection found that adults with elevated blood sugar had a 3-fold higher rate of recurring urinary tract infections compared to those with normal glucose levels. For women over 50, recurring yeast infections that do not fully clear with standard treatment are one of the most commonly overlooked signs of undiagnosed elevated blood sugar. For men, recurring skin infections or slow-healing rashes in areas where skin folds are a similar signal. If you have had 2 or more of the same type of infection in the past 12 months, that recurrence pattern is not bad luck. It is your immune system telling you that something systemic is making it harder to fight back. A fasting, glucose test, and a hemoglobin A1C test together take one blood draw and 5 minutes of your time. The A1C test measures your average blood sugar over the previous 3 months, which means a single high reading cannot skew it. If you recognize 3 or more of the 7 signs in this video, book that test this week. Do not wait for your next annual checkup to bring it up.